Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today I'll be speaking with General Surgeon Dr. Kimberley Clark-Paul about breast cancer and surgical treatment options. Dr. Clark-Paul, thank you for being here today.
Thank you.
Now let's start with the basics. What is cancer?
Well, cancer is actually, there are many different diseases that go by the term of cancer, but what happens is when a cell when it starts to divide abnormally and continues to divide, and cells are supposed to have programmed cell death so that when they get old they die, but cancer cells don't know that, and they just continue to divide and to grow, and they continue to divide and they continue to grow until they form a mass of cells that we call a tumor. That's what we call a tumor. And some tumors may be malignant and some tumors may be benign. Malignant is that's the term that we use for a cancer. And when cells are malignant, it means that they have the ability to invade in the area where they are, or they can spread, or the term metastasize. They can spread to different parts of the body. And that's what defines a cancer. When a group of cells, which should otherwise programmed cell death, they should die when they get old and stop producing, but they don't, and they continue to grow and to multiply, and then they can invade the area where they are, or they can spread by the lymphatics or the blood vessels to distant sites from their area.
Can you describe for us how cancer affects the breast and the anatomy of the breast?
Absolutely. If we look at the breast is actually an organ that is it doesn't go into the chest, it doesn't go into the peritoneal cavity, so it sits kind of on top of the major internal cavities of the body, but it extends from about the second rib to about the sixth rib, and then it extends over to it extends from the midline to really sometimes it will go into the axilla, or the area under the arm, and that's the extent of the breast. Now, the important thing about the anatomy of the breast is that, if we look at the next slide, is that the breast is composed of about 15 or 20 segments that are called lobes. And the lobes are made up of lobules. The lobules are the secretory portion of the breast. And the lobules then drain into these ducts, and the ducts empty at the nipple area. So when we talk about cancer of the breast, really any histologic tissue type that is present in the breast can form a cancer. And the major histologic types that we see there are the lobules and the ducts. Now, let me just step back for a minute. Also within the breast, there's adipose tissue or fatty tissue. And as women get older, there tends to be more of the adipose tissue than of becomes more prominent. And also there are nerves and vessels and lymphatics. But the major types of breast cancer, the most common is called invasive ductal cancer. And so you see where these lobules drain into the ducts. Within those ducts, those cells can become abnormal, and that's the major type of breast cancer. Now, we also have invasive lobular cancer, where the cells in the lobules of the breast can become malignant. And then we have what's called ductal carcinoma in situ, which probably many people have heard of. What that means is that one of the cells within the duct looks like a true cancer cell, but it's confined to the duct and it hasn't spread out, so it can't metastasize or spread through the body. So the major cancers that the most common that we will see is invasive ductal cancer, or ductal carcinoma in situ, which is like a precancerous lesion, or lobular carcinoma, invasive lobular carcinoma.
Now, what are the risk factors for developing breast cancer?
Well, risk factors are actually divided into two groups. The risk factors can be non-modifiable, something you can't do anything about, or modifiable risk factors. And the non-modifiable risk factors, because you're a woman, you have an increased risk of developing breast cancer. As a matter of fact, we think that there will be over 230,000 cases of invasive breast cancer in the United States this year, and about 60,000 cases of ductal carcinoma in situ. So the greatest risk is by being female. Second risk is, and I don't know, greatest or these two go together, is by virtue of the fact that you're getting older. And so age is a risk factor. As a matter of fact, most breast cancers are diagnosed after the age of 50, 55. And so age is a risk factor. Your family history, you can't do anything about that. If you have a first-degree relative that has breast cancer, your risk goes up. Also, risk factors, sometimes genetic things can be risk factors. There's certain genes that's called the BRCA1 and BRCA2 gene, which that genetic alteration, if you carry that gene, you have an increased risk of developing breast cancer. As a matter of fact, we think that if you have a BRCA1 positive gene, that your risk may be over 60% as you age.
Wow.
So that's pretty high. So those are non-modifiable risk factors. We think race is a risk factor. We know that there are more breast cancers diagnosed in Caucasian women, and we think that that may be a risk factor. And those are things you can't change. But then there are modifiable risk factors. And the thing that I like about the modifiable risk factors is what's good for you is good for you, and what's not good for you is not good for you. So for example, we know that obesity, especially in postmenopausal women, increases risk of breast cancer. And we think it probably does so by increasing estrogen production in the adipose cells. So obesity, and obesity is bad for your heart, and it's bad for diabetes, so that's if you correct it for breast cancer risk, you're correcting it for other things as well. We know most studies show that smoking increases risk of breast cancer. So if you stop smoking, you're going to be healthier all the way around. We know that another risk factor is alcohol consumption. If you drink even moderate alcohol consumption, you have an increased risk of breast cancer. We think that healthy diet, meaning healthy diet with grains and fruits and vegetables, decreases risk of breast cancer. They actually have studies that they think exercise decreases risk of breast cancer. So really, all of those things that make you healthy decrease your risk of breast cancer. So those are modifiable things, but those are just pretty much simple lifestyle changes.
Dr. Clark-Paul, this is great information. We need to take a break. We'll be back in a moment.
Okay, sounds good.